Good morning, everyone. I'm just still waiting for Poco Pare. I think he's playing a song, so just bear with me as we wait for him to join. So we'll be doing the COVID-19 update on Hospital Radio Bedford, global update, and we'll be talking about all the updates on COVID-19 in the UK and globally, and we'll also probably mention about Lata Mangeshkar, the Bollywood singer who passed away, and that was quite tragic yesterday to see her funeral. Condolences to her and her family, and obviously the rest of India that's mourning her death. She was a legend. I remember listening to her songs from very young, and definitely, definitely as a nightingale, as everyone has described, and the queen of Bollywood singing. So it's sad to see that her funeral yesterday, as well as knowing that she's left a legacy of her singing over 3,000 songs, and also that she's inspired so many people. I mean, my parents, my grandparents, we all used to listen to her. So I grew up listening to Lata Mangeshkar, and it was quite emotional to watch her funeral yesterday. And also to say that I think today is a national holiday in India, so that's it's been declared a national holiday. So she has been someone who has been recognized by the people in India and also all over the world. And Narendra Modi had a lot of good things to say about her in his interactions with her, and she was bestowed the Indian flag as well. Her family was bestowed that. So she's it's quite tragic, to be honest. I'm not going to go on a bit more about that, and we'll probably start in a few minutes with the Pogo Pari. So just bear with me as we try to get the connection sorted. Thank you for waiting.
And we're going to be talking some health issues here. Good morning, Dr. Sashmi, and welcome to the show.
Good morning, Apoko. How are you?
You unmute yourself, please.
Good morning, Apoko. How are you?
I'm very well, thank you. I'm very, very well. And you? You and your family, everybody okay?
No, we're all good, thank you. Everything's looking a lot more settled, and the Omicron wave seems to be very much under control in the UK and globally, isn't it?
Yeah, that's what we're going to be talking about today. And it's a shame that we couldn't get together on the 2nd of February to celebrate 2 years of updating, our listeners on the COVID situation.
I know, I did think of that, but happy anniversary for that. I know it was your wedding anniversary as well.
It was my wedding anniversary as well.
How was your celebration with your other half?
It was quite calm, but really, really lovely. Really lovely.
Think 2 years had gone on and we had been broadcasting. I haven't calculated, but I'm sure we've done a lot of shows. We've completed
loads of it.
It was really a good journey to reflect on. 2 years. Thank you so much for the opportunity.
Through the years that we've been doing this, not just the COVID, but prior to that, COVID took over because COVID is what's in now.
Yeah.
But before that, we'd done loads of stuff: mental health, this and that, anxiety, depression, schizophrenia. We did diabetes and all sorts. And throughout this whole journey, what I take, to be honest with you, Dr. Seshni, is the fact that it gives me joy to know that people are being educated on the things that worry us, and then people know what to do about these things. They get how to get help and how to recognize these things when they come and all that. And I'm really glad that you are the main pillar. You're the person who does all the technical stuff, and I only ask questions.
Well, I've enjoyed it, and as you know, I always quote Nelson Mandela: "Education is the most powerful weapon." And to overcome the COVID pandemic, which we all started, it started in December 2019. As you said, having that knowledge, that understanding, that awareness, knowing what treatments are available, how to prevent it, and then talking about the vaccines, it's all helped everyone. So I think the more and more we understood more about it, I think the more confident people felt to be able to tackle the COVID pandemic. So it's definitely helped us. And I think raising awareness about mental health has been so important. So I definitely want to continue that with you, talking more about mental health because it's so important.
Yeah, it is. It is. It is. Right. In the news, there's not to be honest with you, there's not a lot about COVID in the news. I've been scrolling through. I've been looking at what's going on with COVID. COVID. There's not a lot. It seems as if things are sort of getting better. But what's caught my eye?
That's true. Can I just, before you start, can I just say something? I know I just wanted to hear what your agenda, and I agree there's not that much, but just it's COVID related. We've had a very well-known Bollywood singer, Lata Mangeshkar. She died at the age of 92 in India yesterday. They had her funeral live from India, from Mumbai. And she was a singer. She was well known, and to be honest, she was the most well known singer. She compiled over and sang 3,000 songs, Indian songs for Bollywood, and it was sang. Her songs were also in about 36 other languages. So and it has actually been declared today a national holiday in India for her. So she's really well known, very well respected, and to watch. And I grew up listening to her, so not just me, my parents, my grandparents, because all the Indian movies, you'd hear her voice, and they call her the Nightingale, and she does have a beautiful voice. So I just wanted to just say it was COVID related on another legend taken away due to COVID. So COVID is something that has obviously affected us, and just to say condolences to Lata Mangeshkar's family and the whole of India that's mourning her death. And she's inspired so many people, and she'll continue to inspire people through her songs. When you listen to her songs, you feel those emotions, those memories come back. So, not many people have that gift, and she had that gift of helping others.
Interesting. Right.
Thank
okay.
you.
Back to what I was going to talk about. The last-minute intervention in Whitehall has delayed plans to tackle the backlog of patients on hospital waiting lists in England. Now, the reason why I'm bringing this up is there's a bit of argument that the what's his name, the health secretary, what's his name again?
Sajid Javid.
Sajid Javid. He is denying reports the Treasury had blocked the announcement, blaming the Omicron wave for the delay. But however, the government has announced a new online service that will allow people needing non-urgent surgery to get information about waiting times. Now, my argument here, in the news, just before I got on air, I was listening to the news from Hospital Radio Bedford, and there's this argument that they're kind of blaming everything on the Omicron or the COVID pandemic. And there was an actuality, I can't remember who spoke, but he said that even before the pandemic, the NHS was short of 40,000 health workers already. So, but it seems as if everything is being blamed on the COVID pandemic and on the Omicron. What's your take on this one?
Well, my take, I do agree with them, because as much as maybe there was a shortage of NHS staff, I do believe that the COVID pandemic has obviously affected staff. It's affected absenteeism, it's affected delivery of service, delivery of care, delivery of appointments on time. There's been longer waiting lists for surgeries, for non-invasive treatments, for appointments. So I think we do have to understand that the COVID pandemic has affected the delivery of service and care, and I think they are correct in saying that. I think there's truth in what they're saying, and as long as it's recognized now, and that we're coming out of the Omicron wave, which obviously has not been as serious as everyone predicted, there is hope that obviously we can now look to planning in terms of thinking about how to tackle this problem. How do they now deliver service in lesser waiting times, and how do they deal with the backlog of appointments and procedures and other interventions that need to be done. So I think that should be now the focus of providing that care and trying to get through that backlog so that the patients don't suffer, because the ethos of the NHS and private care as well is putting the patients at the heart of center of everything. And I think people do understand there has been a backlog. GPs were not able to see patients face to face. They've had to do lots of online consultations, so everyone has had to change. Even people requiring specialist services, they've had to wait. People requiring hospitalizations or requiring hospital interventions and appointments all have had to wait, because we had to focus on COVID. We had to focus on the patients that had COVID. We had to focus on the consequences of COVID, as well as looking at the vaccine rollout. So I would say the Omicron has contributed, because Omicron started in December. So it started November, December, right? And we've seen it progress. But the good news is, I was watching and I was reading yesterday, and the good news is scientists are predicting by March 11th will be the end of Omicron. What they're saying is we will not totally get rid of Omicron wave or the COVID-19, but it definitely, the numbers will decrease, the mortality and morbidity associated with COVID-19 will decrease, as well as the severity of the illness because of the vaccine rollout. So there is good news. So yes, there is a backlog. Yes, the Omicron has contributed to it, and COVID-19. But it's looking really optimistic. So yeah, that's what I wanted to say.
Okay. Now, before we do some, I was going to talk about the Prime Minister, the Subre report, and the party in that, and all that. But before we do that, I've got some. I'm just reading something from Australia.
Yeah.
And they have reopened their borders. They say double vaccinated tourists will be able to travel to Australia for the first time in almost 2 years. The announcement about reopening borders also allows other visa holders entry into the country, which had some of the strictest border controls throughout the pandemic. Now, borders reopened on the 21st of February, and Prime Minister Scott Morrison said, "We look forward to welcoming you back." They've had some strict COVID rules there in that country, haven't they? They're surprised they're reopening borders now,
They did very well, and I think more and more countries will follow from Australia, because what we are seeing now is that the Omicron wave, as predicted, has not been as serious as the Delta wave and then the SARS-CoV-2 strain. So what we are seeing is more and more people will be opening their borders, so more and more countries will follow on from the example from Australia. And Australia has done really well with the COVID pandemic, and it's fantastic news. And we're probably going to be reporting more and more like this. 2 years on, Apoku, there is so much of hope, so much of optimism now, looking to the future. So, it's great. It's great to be part of this journey, to see how...
You know what I get? You know this kind of sense I get when I go around, like when I go to the shops and different places into town, walk around town. It feels as if people don't fear the virus anymore.
Yes.
And I'm not saying this, it's not because people don't take precautions. They do. Some people still wear, face masks and all that. But if you remember, Dr. Session, when this whole thing started, You'll be probably walking on this side of the road, and somebody sees you, and they just move to the other side of the road. It was so we feared it so badly that you didn't want to get close to anybody whatsoever. I know that, but it's not the same. I don't get that feeling anymore when I go around town. Everybody just say, "Oh, hello," they just walk by and do that. So it's getting better.
And that's amazing, isn't it? It's good to see how we've grown, how we've learned, and how people have coped with it. Because yes, in the beginning we were all so fearful. I wrote about coronaphobia as we spoke about it, and how people were fearing being in contact with other people. And then obviously, WHO guidance was to wear masks, hand sanitize, wash your hands, maintain social distancing of 2 meters, and then later on get vaccinated. So I think everyone's been following the guidance, and because we've seen the numbers come down, because we've seen Omicron wave not as serious as the other waves, and because we're seeing that people, even if they are getting COVID-19, a lot of people are saying it's like a flu. They have to just just follow on with those days that they are having the infection, like they've had a flu or cold, and then recover from it. So this is what we are seeing. So that is why people are not as fearful. And I think the vaccines have helped a lot. There might be people that are still disagreeing. I saw yesterday, I don't know if you saw, there were anti-vaxxers in Manchester. So there's still a lot of protests against vaccinations. Lots of anti-vaxxers, but to be honest, as I've always said, and you've said, the vaccinations have definitely helped. They've helped our patients, they've helped our communities, they've helped me personally and my family. So I'm so grateful for the vaccinations and the research that's gone into it, and the guidance that we've received from the government and from WHO, from the World Health Organization, from Dr. Tedros and his team.
Another story that caught my eye was what's happening in Ottawa, in Canada.
Yes.
And vehicles and tents blocking roads have paralyzed the center of Ottawa as truckers protest against COVID restrictions. The demonstrators outnumber police in Canada's capital, and the city is completely out of control, says the mayor, Jim Watson, who has declared a state of emergency. It gives the city additional powers, including access to equipment required by frontline workers and emergency services. So, people are protesting against certain COVID restrictions and, of course, vaccines as well, or vaccination. They've got lots of anti-vaxxers all around the world. Yeah.
Well, the protests are still going on. As I said, Apoku, I'm still concerned that there's people protesting against it. We have so much of evidence. Being a doctor and a psychiatrist and having the opportunity of knowing people that have had COVID-19 and have had the vaccinations, I can certainly put my hands up and say that I know, as I told you, if my mum was here, because she had asked me about the vaccines before she passed away, and if she was here, I would say, Mom, the vaccines have helped us. You would have seen it.
You weren't too sure yourself in the beginning, were you?
No, because I think, for me, the reason of uncertainty at that time, Apoku, was because no vaccines have been created in such a short time. So definitely, obviously, with the advancement of research and technology that we have, which obviously we never had in previous years, in previous epidemics and pandemics. So we were fortunate this time. I think that's where my uncertainty was. But when I've seen it for myself, working on the front line, as a doctor treating people with COVID, and, then knowing people personally, friends, family, colleagues that have had COVID, and then they've had the vaccinations, I can certainly say that they've helped my patients, they've helped me, they've helped our families, our communities, and, they've helped everyone globally. So I'm still struggling to understand why people are saying that it doesn't work. And why there's protests against vaccines. I understand it's about pro-choice, but we do need to, I think the governments need to put proper, guidance for people that are protesting against vaccines. Unless they have a medical exemption, I think we need to look at how we can get them to take the vaccine.
Yeah, but Dr. Sashni, when you say the government needs to put in proper whatever, what exactly do you mean? If people don't want to be vaccinated.
I was afraid you're going to ask that.
Yeah. If they don't want to be vaccinated, obsessionally, why should they be?
Well, I think I understand that, and I'm all pro-choice, but I'm pro-choice to a certain extent. When you're doing something that's going to affect other people, we know that there are people that are vulnerable. If I am working at the front line, I'm not taking the vaccine, I'm getting COVID and then spreading it to my patients, I would not be able to live with myself. Knowing that I'm causing someone else harm. And we take an oath as doctors, healthcare workers. They do it because they care for their patients. So I think we need to make these people accountable for what decisions they are making. So I'm not sure what I would want the government to do, but certainly I think they should be held accountable for the decisions they're making. And I think the government,
that's a bit strong, Dr. Seshni, saying that they should be held accountable for the decisions that they take. They've got the right to take their decisions, don't they?
I think it is, but I feel in this context, knowing that we've had millions of people die from COVID-19, I understand the severity and the strains now are not as serious, but it's still something that can affect people. And if you are going to get COVID and pass it on to someone else, and especially because you put yourself at risk of not getting the vaccinations, knowing obviously I do know the vaccinations are 100% effective against COVID-19, but it certainly has helped. So it's helped us, and I just feel they need to be held accountable. I don't know what needs to be done, but that's what I feel.
Let's move away. It's a bit controversial, that one. We'll talk about that later.
Yeah, I know you wanted to talk about the Sugray report, so.
We'll talk about the Sugray report in a minute. I just wanted to. We're still on the vaccination, but not in that way. Booster jabs. Now, there's this fear that once you get one booster jab, every so often you have to get another one, or probably yearly, or monthly, or something like that. How true is that?
Yeah, so it is becoming a reality actually. So we do know that there is possibility of a fourth vaccine that's going to be rolled out. So it is something, as we've had the immunization schedule, we've all grown up with it from birth. We've all had to have vaccinations against MMR, GPT, and other illnesses and flu vaccines. So it is going to be something that is going to be incorporated, I would say, probably as part of the schedule or something separate, where like we get the flu vaccines every 6 months or every year. People will be encouraged to take the fourth, fifth, and sixth, or how many different COVID vaccines that there will be.
Well, that would mean every so often you have to consider and get jabbed again. I do not think it will go very well. It will go down well with people. It's people are struggling enough. They're struggling to get the double dose and then the booster, and then now it's not a fact yet, so we don't know. But if we get told that we'll have to get a booster jab every so often, that's going to be a big problem. I promise you that.
I believe you. I think, yes, I think taking 1, 2, and then the boosters, probably everyone feels that's enough. But let's watch this space.
Honestly, I personally feel that's enough for me. Anyway, let's talk some Sue Gray now, quickly because you haven't got too much time. That's why you came on early, and you've got to go and work and save some lives. Now, as the fallout continues from the initial findings of the Sue Gray report on lockdown parties in Downing Street, Boris Johnson plans to make further changes to his team. So you see, it's affecting the whole political landscape now. Now, the Prime Minister vowed to change how Number 10 is run following the publication of the scaled back report, which, see, this is their point. Scaled back report, okay, which looked into events while COVID restrictions were in place. So while police investigate some of the gatherings, Mr. Johnson is seeking to reassure Tories who are wavering about his future. He's called some to try to persuade them about his changes, and which could include a new chief whip who is in charge of party discipline. Is it? Is it? Do you think? Well, we're going to be a bit. We're going to get a bit political with this one. Okay. Is it just? Is it doing this just to save face or to keep his job?
Exactly. You took the words out of my mouth. I would agree with you. So I think he's doing that to demonstrate, obviously, insight, to demonstrate he understands what has happened and he's looking at solutions, which any person would do in a situation like this. Boris Johnson obviously does want to keep his job. He has been told by others in his cabinet that he should resign. So there's lots of criticism. Lots of people are very unhappy. The public as well are very unhappy about his so-called parties, and I'm not going to go into it, but the report is there, so we all know what's been going on.
Yeah, we know what happened. They were having fun. I mean, he himself, in part of it, was apologizing and saying all sorts of things that he didn't know this and that, but we all know that's not.
Yeah, I mean, I think why everyone's upset is we were all in lockdown. We were
and they were the ones who told us to stay indoors and not party. And not stay in groups of 6, or even that time in May, we didn't have that group of 6 rule, did we?
We didn't, and you remember my mum passed away in May, so I couldn't even go to South Africa. We were stuck indoors. People couldn't come and visit us. People that were offering condolences couldn't come and visit. We didn't go anywhere. So because I wanted to go to a temple that time, and we couldn't even go anywhere during that time. So
you can understand why people are angry.
Exactly.
I mean, for example, you would have loved to go see your mother, or you would have loved to go and at least pay your last respects.
Exactly.
But you couldn't go because he told us that we can't.
We went
and then he went to party with his cronies.
Exactly, and I saw lots of comments on Twitter where people are saying, they also didn't have parties for their children or their family. They were all in lockdown. So I think it's really worrying. It's really worrying about what has happened, and I think the leadership, obviously, in any leadership, it's so important that the leader sets an example. We all lead by example. When we look at leaders, you look at Nelson Mandela. You look now at Joe Biden, Kamala Harris, previously Barack Obama, all these leaders, they all have to lead by example. So it's the same with Boris Johnson, we are all looking up to him. And if we have someone that's going around during the COVID-19, with such behavior, knowing that we're in the lockdown, and also he also even got COVID in March that year.
He did.
So
he did. You would have thought that he would think hard and fast about his decision to go into the garden and join his colleagues.
Yes.
He shouldn't have had. There shouldn't have been a party at Downing Street at all.
No, and I think any form of get together or gathering, some people are saying, oh, if it's just is it called a party if you just have a cake and someone coming and singing happy birthday and a few people? It is considered a party. It's something that's been set up, whether it was him or whether it was someone else that set it up.
We know what happened. We know what happened there.
Yeah. So, any form of gathering, then we could have opened our homes and had parties. How many celebrations we've all missed? I know.
I couldn't even have a barbecue. Because my prime minister said I couldn't. And then he went ahead and drank champagne and had some fun. It's gone. Anyway.
Yes. Well, I think we have to move on from what has happened. Let's hope that Boris Johnson has learned, and obviously he's trying to make amends. But again, as I said, the public is very unhappy. People in Downing Street are unhappy, and but I think what the concern is, if Boris Johnson does leave, who would take his place? Would Rishi Sunak be someone that would be the next PM, or who would be able to go to take his place? So we don't really have anyone else. So we are really depending on Boris Johnson, to be honest, at this moment in time.
Well, I would honestly disagree with you on that one. If he goes, I'm not saying he should, but if he goes, there will always be somebody. Yeah. There'll always be somebody there. The person might not be as good as him or might be better. We don't know, but there's always somebody who yeah. Anyway.
Well, let's watch this space and see what happens. And, hopefully he's learned and he can demonstrate that. And as you said, save face to keep his job.
Absolutely. Anyway, so what I do, it's just.
I've got the numbers in front of me, so we can do that. We can do that, and then
I was worrying about your time.
Yeah.
I know you've got to go.
No, we'll do the numbers. Patients. We'll do the numbers very quickly. So today, as of the 7th of February 2022, we have the coronavirus figures on the Worldometer. So we've had 396,363,103 coronavirus cases worldwide. Total number of deaths over 5 million, reaching 6 million, I would say, which is 5,759,964, and every life matters. Total recovered is 315,181,677. And the top 5 countries, USA number 1 with 78,017,402 positive cases. Total number of deaths, 926,029. So they're nearing 1 million. That will be a milestone. Hopefully not. India, number 2, with 42,272,014 cases, with 502,905 deaths. Brazil, number 3, with 26,536,597 cases, with 632,289 deaths. France, number 4, with 20,758,371 positive cases, with 132,506 deaths. And UK, number 5, with 17,803,325 positive cases, with 158,318 deaths. And we'll go to South Africa, is number 19, with 3,623,962 positive cases, with 95,835 deaths. And I think Ghana is quite low down. I'm just getting it, sorry.
109.
Yeah, just got it. Yeah, 109. Thank you, Poku. With 157,541 cases, with 1,412 deaths. And we'll just look at the last 24-hour figures for the UK, which definitely is quite promising that things are getting better. So total number of cases that we've seen in the UK is 54,095 cases. So it's gone down significantly.
Okay. It's gone down, yeah.
With 75 new deaths. And the day before that was 60,322 cases with 255 new deaths, 259 new deaths. And before that, the day before, the 4th, it was 83,641 new cases in the UK with 254 new deaths. So looking at the figures of the last 24 hours, it's definitely reduced significantly, to 54,095 new cases with 75 new deaths. So every life matters, and we need to continue to adhere to the guidance of wearing masks, hand sanitizing, maintaining social distancing, and getting vaccinated and isolating if you have any symptoms and getting tested.
Absolutely. Thank you very much.
Thank you, Poku. Have a fantastic day. Lots of love to everyone, and let's stay safe. Let's spread the love and not the virus.
Absolutely. Let's face it and not fear it.
Yes, let's face it and fear it, not fear it, which is what everyone's doing. So I think people are a lot happier. We probably need to talk about mental health at some point. We can talk more about COVID and the psychological impact it's had, and other COVID-related consequences, which will be important to talk about.
No worries, we'll do that. Thank you very much, and have a fantastic day.
Thank you, Poku. Thank you, everyone, for joining, and have a fantastic day. Namaste.